Hi, I'm Dr. Dean, and this is a short informational video just on how to apply ointment in the eye. So, majority of the time we prescribe medication. It's in the eye drop form, so you'll get a bottle of drops and you remove the cap and you can place it in the eye, and because they're liquid it's quite easy to put them in the eye. I've got some other videos on how to apply eye drops which you can look at there, but one of the things that a lot of patients struggle with is when ointment is prescribed. So ointments are prescribed for a variety of reasons. One of the big things about ointment is they're very lubricating, and because they are thick they normally stay in the eye for longer periods of time, and so they can carry medications for longer period of time in certain contexts, and they're very lubricating, they're very moisturizing. So in certain instances when we're wanting to deliver medication for longer periods of time, or in patients who are having severe ocular surface disease or corneal epithelial defects, or something where they need very intense lubrication, patients who had Stevens-Johnson syndrome or severe dry eye, ointment might be prescribed. And patients normally don't like ointments, and they normally struggle to get them into the eye, and the biggest complaint with ointment is it blurs the vision, because the ointment is almost like a Vaseline or like a paraffin base, and so all petroleum jelly, it's got that consistency, so it's greasy, and getting it into the eye, it doesn't fall into the eye, and when it's into the eye it kind of causes this kind of blurred vision. So patients don't like it, but there's still context when it's very useful and very helpful, and sometimes patients need to push through to use it. So the basis of it is ointment normally comes in a little tube like this, not in a dropper, and when you squeeze it, you can see how it's already coming out as you open the bottle normally, open the tube. And that's because this is metal, and if you push on it and squeeze it, it starts coming out. So it's important not to squeeze this too hard before you start, because then every time you open up, all the ointment starts coming out immediately. So when you squeeze it, just squeeze it very gently. You'll see some will slowly start coming out like that. The temperature of this is important. The warmer this is, the more liquid it is. So you can put it in your hands and warm it up, and then when you put it in the eye, it's much more liquid. If it's very cold, it will come out like a very thick tube. As you squeeze it, it'll be much more like a long thing of toothpaste rather than being more liquid. But to place it in the eye can be a challenge. There's a few ways of doing that. Obviously someone can help you, but you want to place the ointment in the inferior fornix. So the inferior fornix is at the bottom here. So by pulling the eye down and creating almost a little bucket over there, one can place the ointment into that gap. Now, it's quite difficult if you're looking in the mirror to do this and to aim it right without poking it in your eye. So patients often struggle to put it in themselves. If you have someone to help you, you can pull down your lid and someone can squeeze and put some into that little bucket, and then when you blink and close it, you'll see it'll smear across the surface of your eye. The other way of doing it, if you're doing it yourself, is to put a little bit on your finger. So to put a bit on like that, you put a bit of ointment on your finger, and then you pull down your lid and you take your finger and you just touch it on the pink part, just in that area. You just put it onto the tip on the inside of the lid, and then as you blink, it'll go across the eye. Another way that some people find it easier is to take a cotton bud, to place some on the cotton bud like that. So you've got a nice some ointment on a cotton bud like there, and then pull down the lid and then just place it on the inside gently while they're looking in the mirror like that, and then you just blink and then that goes into the eye. Obviously be careful when you are trying to apply it directly with a cotton bud that you're not putting this into your eye. Sometimes your depth perception can be limited because you're using one eye, so just to be cautious with that. But that's essentially eye ointments and how to put it in. They can be a bit of a challenge, but when they're prescribed there's often a specific reason for it. So I hope that was helpful. I hope you managed to get the ointment in your eye when it's needed, and if you need any more information, please feel free to contact us.